On After 8 this morning, the shortage of doctors performing abortions. Despite protests and court challenges, terminating pregnancies by means of abortion is still a legal choice for women in this country. But there's a new question being asked these days. Who will provide those abortions? Women are having trouble finding doctors who are trained and willing to perform the procedure. According to a study by a University of California researcher, the number of medical residency programs offering abortion training declined by 22% from 1976 to 1987. 30% of the medical residency programs don't even offer abortion training. Barbara Radford is the executive director of the National Abortion Federation. Her group and the American College of Obstetricians and Gynecologists have come up with some recommendations to ensure the availability of qualified practitioners. Good morning to you. First of all, let's talk about how acute the shortage is of doctors who are willing to perform abortions in this country.
It's very serious, Katie. 83% of all U.S. counties have no abortion provider. It's particularly problematic for women who are living in rural areas. There are many states in this country that have fewer than 3 abortion providers. South Dakota, for example, has only 1 physician in the entire state that will do abortion, so it's a very critical problem.
It's growing increasingly problematic in urban areas as well, though, isn't it?
It is, although it's not nearly as serious. We actually had the symposium and issued the report so that that would not happen. We saw that there was a critical problem in rural areas and wanted to make sure that it didn't extend into metropolitan areas, although we have had reports that there are some problems in the city of Atlanta. For example, we have heard from our own members that they're having a problem finding well-trained physicians who will provide abortion services.
If you live in one of these counties or one of these areas where there is a shortage of doctors or no doctor around who will perform the abortion, what is your alternative? What are women who live in these parts of the country doing?
Well, what women must do and do is travel, or in some cases we're quite sure they are having children that they do not want and cannot care for. Now, there are obviously there are other problems that women have in these areas in terms of health care. It's not just the travel, it's the money involved. In a pregnancy, if you're deciding to terminate, you need to have that abortion as early as possible. For many women, if they must travel, it means delaying the termination and therefore taking more of a risk. So there are many complications that result from the fact that there is no provider in that particular area.
What are the reasons medical training programs are not offering doctors the chance to learn abortion procedures?
Well, I think there are many reasons, not the least of which is there simply isn't much understanding of why it's so important for a physician to learn to do abortions, and particularly in obstetrics and gynecology. Those physicians who are taking care of women and women's health need to be reminded that that includes termination of pregnancy as well as the carrying to term of a pregnancy. And while we talk a lot about OBGYNs, this is not specific to them. It also should include family physicians, and particularly when we're talking about rural areas, because many of the physicians who are moving to practices in those areas are family doctors. So we are also encouraging residency programs in family medicine to begin to train physicians in abortion practice.
But you're looking not only at physicians, but other individuals.
That's right. One of the recommendations from our report is that we begin to train mid-level clinicians, meaning physician's assistants, nurse midwives, and so forth, to provide first trimester abortion procedures. We have a couple of states now that allow mid-levels to do abortions, and they have been very successful in terms of low complication rates.
Well, you're talking about using mid-level clinicians to perform abortions under a doctor's supervision. We visited one clinic in Vermont where physicians' assistants perform abortions, and their rate of complication is often less than that of doctors.
This is the Vermont Women's Health Center. Can I help you?
Since 1972, the Vermont Women's Health Center has trained and used physician assistants to perform routine abortions. The center is one of only 2 programs nationwide where mid-level practitioners perform the procedure.
Part of the problem with physicians' assistants being able to deliver abortion services is that many states have specific abortion statutes that say a physician only can provide the procedure. And that was done largely because for so long, before abortion was legal, all sorts of untrained people were providing the procedure. The thing that's interesting is that a lot of OB/GYN care is delivered by nurse practitioners and physician's assistants, and it's a very natural extension of our services.
With 14 years experience in OB/GYN care, physician assistant August Burns is training to do abortions.
I need to let you know that I'm training here to do abortions. I have been a physician assistant in women's health care for the last 14 years, and now I'm training to add this to my skills. Does that feel okay with you? And Janet will be here supervising me. Is that fine? Yeah. Okay, then we're going to go ahead. It makes all the sense in the world. There's a large number of well-trained mid-level professionals who are able to provide this service very well, very competently. It's an outpatient service. It's a way of cutting down on costs, not having to pay the high salaries of physicians, and still provide excellent quality care.
Your blood pressure today is 140/82, which is a little higher than it should be for how far along you are in your pregnancy.
The center's medical director, Dr. Cheryl Gibson, was trained to do abortions by physician's assistants. But she now deals with more complicated OB/GYN problems. She admits that many of her colleagues have decided not to train in the procedure, or they've abandoned abortion services in their practice.
Many physicians might choose not to provide abortion services because they would have to deal with protesters in front of their offices, with hate mail, with hate phone calls, and I think that's a deterrent.
What we've started to sort of believe in this country is that there's three different groups of women, or two different groups of women: women who have babies and women who have abortions. And that isn't the case. Of course, they're the same women at different times in their life. And so if I can go to my physician for prenatal care, for a delivery, for treatment of an OB/GYN problem, I should also be able to go there for an elective termination or an abortion procedure.
Barbara, do you think that we'll see more of these kinds of programs like the one in Vermont? I know there's one in Montana. Do you think this will catch on?
I do, and we're going to help it move along. I mean, we're confident that this is a way to help reduce the shortage, and we've been very encouraged by the success they've had in Vermont and in Montana as well.
Should women feel confident in using a physician's assistant?
Most assuredly. I think you can. There is data that's been published that shows that their complication rates are the same as or less than physicians providing the service. And as you can see from the tape piece, these physician's assistants are training doctors in how to do abortions. So women should feel very comfortable in having a mid-level clinician do an abortion procedure.
Apparently, doctors are reluctant to perform the procedure because they're fearful of incurring the wrath of anti-abortion forces, protests, hate mail, etc. Is that a big problem?
It is a problem, although it's only one that's contributing to this particular shortage. It's one that that we're very familiar with and that we're able to help physicians with, but certainly it has had some impact.
Do some doctors have a real ethical problem with this?
Certainly, there are some doctors that do, and in those cases we certainly wouldn't insist that they be provided with the training opportunities, but it's a very small percentage, Katie. Most physicians are pro-choice, and most, we are sure, are willing to learn to do the procedure. They simply need to know that they need to learn. And one of the reasons they don't understand that, I think, is because young doctors today have grown up with legal abortion, and their assumption is that there is someone else to provide that service. What this report tells them is that, in fact, they must learn to provide the service.
Because right now, older doctors are the ones who are.
That's right, and the older ones are doing it because they've lived through illegal abortion and understand what that means, and that's where their commitment comes from. We're going to pass that commitment on to younger physicians.
Barbara Radford, thank you so much.
Thank you.
We'll be back with much more on Today after these messages.